This
no X-ray.
conference will now be recorded.
Excellent. I'm just setting up the record button. Sorry, Beth. Go ahead, Dr. Bard.
Yeah, so since I trained in Europe in technologies not used in the United States over the past actually 10, 20 years, they're starting to bring them back to the United States. So I'm working with one of the international companies that is going to be using non-invasive ultrasound technology to see how aggressive a breast cancer is, if it's involving the skin, if it's spread to the lymph node, and where this company is trying to make this portable equipment, or at least small equipment that can be used at private offices.
Unbelievable. This will be amazing.
Yeah, well, look, the problem with the male breast is the chest wall is close to there's not much breast tissue in general. And if the tumor is involving the skin, then you've got a completely different ball of wax. For example, I had a guy this morning from Western Pennsylvania. He had a squamous cell cancer, a small one, on the neck, and he wanted to know, should they cut it off? So I took a scan and I said, yes, it's very small, but you see the bunch of grapes inside the neck? These are all metastatic lymph nodes, and this took 2 minutes.
Wow, excellent. That's amazing.
What we're trying to do is create digital biopsies, so you don't have to biopsy lymph nodes and do lymphadenectomies in patients.
This is fantastic news. It is, truly.
So, Dr. Barnes, can I ask a question about that?
Sure.
Would that replace sentinel node testing?
Absolutely. Matter of fact, it's my new textbook, which is coming out in 3 weeks by Springer, and in the last book I wrote for the Derm Society, and all the Europeans, that's what they use. They use digital biopsies to see if a lymph node is abnormal or normal, and if one of them looks slightly abnormal, you stick a tiny needle in and sample it like you do thyroid tumors. There's no major surgery going on.
This is fantastic news.
Well, this has been done for 15 years all around the world. Nobody's doing it here, so this is the mission of your society. Make it easier for men to get diagnosed, and also make the surgery less invasive if you need it.
Wonderful news, that is.
Can you repeat what it's called? Can you repeat the name of that, please?
Okay. We're using 3D ultrasound, and we're using laser and also optical technologies to see the margins of a tumor. In other words, after you cut out a tumor and something recurs, you want to know if it's a recurrence or just a keloid formation in the skin. And these optical technologies tell you if you've got it all and don't need an operation. This is optical stuff being done, say, at Mount Sinai and all over Europe, for example.
This is great. Let me ask, there's another caller on here. Could you let me know who you might be?
Hey, Peggy, it's Mike Singer.
Oh, it's Michael Singer. Wonderful. Great. I want to just add your name here, so this is great.
My go-to meeting wouldn't connect, so I'm dialed in.
Okay, good. We got you there. Well, this is wonderful. You know, I want to introduce, we have Dr. Bard on the line too, Michael, so I didn't know at what point you came in, and Harvey Singer's here, and Jeff Hoffman. And our two guests, one is Lisa from Survivor Eyes. And we're going to let her, since she was the first one here, to just sort of tell what she did, because we talked about Lisa at our last conference, but now she's going to be able to tell you guys what it's all about.
You get the real deal.
Go for it, Lisa. You go ahead and present what you're doing.
All right. Well, thanks for giving me the floor. Hello, everybody. I am a cancer survivor myself, diagnosed in 2008, and I'd say I'm about 8 years cancer-free. I learned a lot during my treatment. One of the things that was my biggest takeaway was how the treatments that are designed to save our lives can impact our appearance. And it became even more apparent when a very dear friend of mine was going through treatment, and she had, after her second chemo, lost all of her hair. And she was a Hispanic woman with a big, beautiful head of very dark hair. And she was not so worried about the hair on her head because she had scarves and hats and wigs, and she was completely locked and loaded and ready for that. But what blew her mind was what she looked like in the mirror once her eyebrows were gone. And she wasn't somebody who was a talented makeup artist, and so putting on 2 matching eyebrows after 2 hours, she gave up because she said she looked like Groucho Marx and an angry emoticon and everything but a normal person, and she even scared her kids. So she said, I don't want to leave the house. And this really impacted me. I felt so bad for her. And I have a background in beauty, and she called me and said, just get over here and help me and just put on a couple of eyebrows so I can go to church, because it was Christmas time. And so while I was putting on her eyebrows, and I was feeling the lack of self-confidence and the embarrassment and the shame and all the feelings that she was feeling just because her eyebrows were gone. And I knew that there was a solution, and I had to find it for her. So I went online and I looked for an eyebrow kit that had everything that somebody who wasn't a makeup artist could use to just put on 2 matching eyebrows and look normal. Because that's all she wanted to achieve, was to look normal, so she could walk out the front door and people wouldn't go, oh, poor thing, look, she's sick. So, and I found nothing. So being an entrepreneur, I thought, well, there's an opportunity. So I designed an eyebrow kit that offers 10 eyebrow stencils or templates in all different sizes and shapes, so it would flatter any face, from conservative to dramatic, so going to the office to go into a club. And each one has its own name. It's more of an affirmation than a name. So while you're putting it on, not only can you pick out of the pile which one you like the best easily, but it also kind of plants the seeds of positivity. So we have powerful and confidence and survivor and determination. So each different brow shape has its own name. And then I got some cosmetic that is waterproof and sweat-proof and bulletproof. So when you put it on at 6 in the morning and you go to the office and then you go to the gym and maybe go to hot yoga and then go out to a club the next morning, you don't wake up with your eyebrows on your pillow, they're still on your face. And my friend who worked at Sephora said, that's great that you have that for women, but she said men are coming in every single day looking for some kind of an eyebrow solution, something to take their look up a notch. And a lot of them have alopecia, or they're going through treatment, or they're graying and they're getting bald patches in their eyebrows, or they've got white towhead blonde hair and you can't even see their eyebrows. She said these guys would appreciate an eyebrow kit too, because there isn't one on the market. So entrepreneurial talent said there's another opportunity. So I created Brows for Bros, which is an eyebrow kit for men. Offers 10 different shaped eyebrows, a great little dual-sided brush, and some really awesome cosmetic that once you put it on, it stays on so you take it off. So it's waterproof, sweat-proof, bulletproof. And I brought it to market. And last year, we actually received the award of the 2018 American Small Business Champion from SCORE and from Sam's Club. We sold the product on Costco.com for a year very successfully. And I have found all kinds of different opportunities to help people that I hadn't even thought of. And when I went to Carrie Madrid to see if I could help her and her group, she immediately told me about Peggy and your group. So yes. I reached out to Peggy and I sent a few samples last year for your conference, just so that you'd see what it was and you could kind of touch it, feel it, know it. And I reached out again and said, let's get something going for Breast Cancer Awareness Month, and let's let the fellows know that this is out there for them. so that, if they need help, they don't have to wander around, the makeup aisles looking at ladies' makeup thinking, what do I need? What color do I, what do I get? How do I apply it? Because this kit is the makeup, the brush, the stencils, the instructions, the how to take care of it, how to get it on, how to get it off, everything that you need to know about putting some eyebrows over your eyes. And so there it is.
That's wonderful. And guys, what do you think about the idea?
I love the fact that she's including men, because some men need makeup or prosthesis or something, so it's another opportunity for us, and we're not forgotten now.
Excellent. We love it that she's remembered us too. the whole course.
There's nothing better than underserved demographic to bring a product to market that nobody else has thought about, and I think the appreciation that we get, and the number of people that we can help is just so rewarding. And as an entrepreneur and as a business owner, there really is nothing. I mean, the ring of the cash register pales in comparison to the feeling that I get when I get an email from somebody who said, you know what, I could go to the office and I had a big meeting and I felt so confident and I felt so myself, and it's in part thanks to your brow kit. So, thumbs up. Thanks for doing that. So that's really
wonderful. Well, and this is it. We have a little message from Jeff Hoffman, who his mic's not working, but he says, I did not mind losing my eyebrows, but I hated not having eyelashes. So do you do anything for lashes?
I actually don't do lashes. There are already so many different lash companies out there with really great products. So what I wanted to do was go into the niche that had nothing, and that was the eyebrows.
The eyebrows. All right, so hopefully, Jeff, that answered your question there. And then Dr. Bard, question to you. With you seeing patients and everything, is that something that the men even talk about or think about when they're going through some of this?
Actually, they're happy to know that they're cancer-free.
That's it.
That's enough for most guys. And I got a call from Australia. I got to run now. Bye.
We'll let you go. Thank you for joining in, Dr. Bard. We appreciate your expertise. Okay,
Lisa,
so he had...
Lisa, what's the URL for your website?
www.survivoreyes.com.
Survivoreyes.com. All one word, Survivor Eyes?
Yeah, with an S.
Yeah, so that's Survivor Eyes. We work with a lot of men that are going through chemo. Mostly prostate cancer, and it's certainly something that we can make them aware of, and be happy to do so.
Excellent.
I'm going to be putting together a code for it's going to be Big 20, and my kit normally sells for $39.95, but I'm going to make it $20 for the Men's Breast Cancer Coalition through the end of the year.
That'll be wonderful. Here's another
$20.
Another question from Jeff is, do you have to take them off at night? Your brows.
You don't have to, and it's cosmetic, so you're going to want to take it off eventually, and it's only removed by an oil-based cosmetic remover, and I actually give everybody one in the kit so that you'll know what it looks like and where to go get it. It's made by Neutrogena. You can get it at Costco. You can get it at Rite Aid or Walgreens or any place else. But you can very easily get a hold of those, and they come in a big box, and they're like little towelettes. And you just wipe each brow and then wash your face. And the best testimonial I have for these brows is from a gentleman who put them on in the morning, went surfing, got dressed, went to the office, got off work, went to the gym, went out to the club, and woke up the next morning. And he said he ran to the bathroom thinking, oh my gosh, I wonder if I have like only one eyebrow on. And he said, I looked in the mirror and I looked just as good as I did at 6 o'clock the morning before. So he said, cool.
Amazing. That's amazing.
guys are not, big makeup wearers, so they don't probably know. But you'd want to take off your makeup at the end of a day or the next morning and start over again, just to have your best look.
Yes, agreed.
But it'll stay on till you take it off, probably 24 to 48 hours if let's say you're camping.
That's wonderful. We do have another new caller. Can you tell us who you are? Is this?
I think it was me. It was Harvey.
Oh, Harvey, you're back. Good.
Yeah. Okay.
Gotcha. We lost you. Okay, I just wanted to add that back. That's great. All right, so Amanda, moving on to Amanda from Outcomes for Me. We have her here on our call. And Amanda, would you like to tell your story and what you're doing here?
Sure. So thank you so much for having me on the call. And actually, we're here with Francis from Outcomes for Me as well. He's one of our software engineers. So basically, I reached out to your group because we have an app for your phone called Outcomes for Me, which we just launched earlier this year. And basically, it's an app that helps you navigate your breast cancer. So we offer treatment options that are your standard of care options. We show you clinical trials that are personalized to you and your diagnosis. We have symptom management on there. We also give you information about how to get genetic testing, and we have a lot more coming. So the reason why I reached out today is because we really want males with breast cancer to feel included and involved in our mission to get real-world data. Because with this data, this can lead to approvals of drugs specifically for men, and also more knowledge about what to expect in terms of how long a treatment will work or what kind of side effects to expect, things like that. And importantly, this app also applies equally to men as it does to women, which I think Francis can talk a little bit more about.
Can you hear me?
Yes, we can.
Excellent. Thank you. So a key feature in the app is our treatment guidelines. So we've actually taken the NCCN treatment guidelines for breast cancer and fully digitized them and implemented them in our application. So if you put your diagnosis in, you will see all the steps of treatment that you will go through, all of the drugs that you might receive for every step. And from there, you can see information about the drugs, questions that you might want to ask your doctor, and et cetera. And I'm the one who actually implemented this, and I can confirm that it applies just as equally to men as it does to women. The only slight caveat is that because of the way our diagnostic information is collected, you just have to say that you are post-menopause or that you don't have premenopause hormones in your system, and that based on that, you will get your correct diagnostic information.
Excellent.
That probably doesn't apply to us.
Yeah, no. So all I'm saying is that if you say that you are post-menopause, all the information will be correct. There is a male-specific question coming that will eliminate that question and be even more accurate. Like right now, there are some treatments that are a little ambiguous, but in the future, there will be effectively a male-specific version that is in the works right now. I'm working on it.
Excellent. Amanda, tell a little bit of your story and why you did this. I think it's very amazing.
Yeah, sure. So myself personally, I was a clinical research coordinator at Dana-Farber Cancer Institute in Boston. And what I did there was I worked with patients on immunotherapy trials who were stage 4, and they were kind of out of their approved treatment options, and they wanted to keep being treated. So I worked there, and one of the doctors that I work with actually created this app because he felt it was important to give people the information they need in a way that's accessible to them. And so we kind of started creating this app, and from there, the other co-founder of the app had a breast cancer scare herself, and she, even though she was in the healthcare industry, she didn't understand how hard it was to get treatment information and find out exactly what you should be doing besides, Googling things. So that's why it was really important to them to create the company. So kind of my role at the company is if you request your medical records through the app, I personally take care of all of that. I get the records for you and give you a treatment summary, including all of your past medications and all of the important details that you should know about your breast cancer so that you just have it all in one place. And then, as I said before, Francis is kind of in the engineering side. He's creating the app, and we're kind of working all together to merge technology and healthcare in a way that benefits patients. and everything is free for patients.
That's wonderful. And I just added the website for you all under the chat area. I'll do that for this and Lisa's also, so everybody can have the actual website address. Are there any questions that you guys, Jeff, you or Harvey, have at this point, or Rick?
I have a couple of questions. One is whether this is only breast cancer specific at this point. And secondly, we've seen a couple of other apps that are being marketed or made available by different folks. What makes yours different to what's already out there?
So I can answer that. For the first question, we are breast cancer only right now, but that is going to change. We are planning on expanding into lung cancer next year and other cancers after that. We're just starting with breast cancer because and this is what's different about us, is that nobody else has ever successfully digitized and implemented the NCCN treatment guidelines. Like if you download our app and you put in your diagnosis, you will see every treatment step that you will go through, and you'll be looking at the exact same information that your doctor sees. Nobody else does that right now. And the guidelines for breast cancer are the hardest out of any cancer. So that's why we started with this, to prove that it was possible.
And in addition to that, the way that we ask you questions when you download the app about your diagnosis, and then we only show things that are specific to you. So say if you're HER2 positive, you won't see clinical trials for HER2 negative or the treatments for HER2 negative. You'll only see like things that are directly applicable to you, which makes it easier to kind of find the information you are looking for and what you need.
Mm-hmm.
Is it a mobile app?
Yes.
Yep. So you can download it on the Apple Store or the Google Play Store.
Cool.
That's excellent. Okay.
Yeah, so if you have any questions, feel free to reach out as well. We're always looking for feedback. Like I said, we're relatively new. So, if there's something that someone thinks would be helpful, we're happy to try and incorporate it into the app.
And is this a free app, Amanda? I don't remember if you said that.
Yes.
Or...
Yep. Everything related to the app is free.
It's a free app for anybody to go download. Yep. But you must be a breast cancer patient to be able to download the app. Is that correct or not?
So you can.
Go ahead.
Sorry, I can take this. So when you sign up, there's a place where we ask you like what best describes your situation. Are you in active cancer treatment? Have you just been diagnosed, or are you like in survivorship with no evidence of disease? There's also an option there to say that you're not a patient and you're just looking at the app, and you will see exactly what a patient will see. But it's actually really important to have that option, because it means that when actual patients use the app, we can use that data to determine which treatments are the most effective, for example.
Excellent. That's great.
Is this a link that we can put on our website?
Absolutely. Yeah, definitely. We can send that over to you.
That'd be great. That's Lisa. Yeah, I think so too, Lisa, to put it out there.
Send me your URL.
Yeah, so definitely send us, if you'll send a little bit of paragraph, Amanda, similar to what you sent me about it, and the actual link, we'll put it under our resource pages also, so we've got it. So, because we want to make sure that the guys have all the information they want, and Harvey, because you have his website too, if you want to do any sharing of any of this, everybody's welcome. That's what we're about, to just share information and knowledge, and hopefully it works for you all.
Yeah, we'll put it up on ours too.
Excellent.
That's fine.
Jeffrey, I just saw your question. What do you mean? Can data be shared? Could you be more specific? Like what kind of data exactly?
Oh, Jeff can't. His microphone's not working. Yeah, he can't respond. Okay, so.
Well, he typed a question, so yeah.
Yeah. So if the data.
I can answer. I think he knows. I think I know what he means.
Okay.
So data that you put into the app, we do not share that data. It's completely your data. We don't share that. The only thing that we do is we take the answers to your questions, not relating back to you, and we use it in an aggregated fashion. So we could say, like, out of 1,000 men, 200 had this type of cancer, and this is how they responded to this treatment. We would never use any of your personalized data at all in any way.
Okay, so what he's asking, his medical information in the app with another doctor for a second opinion is why he was asking. Could he share that for a second opinion with doctors?
So if you
absolutely.
if you enter your medical information into the app through our questionnaire, like, you can show it to your doctor, but there's no way to, like, share that. We deliberately don't do that because it's hard to do securely. However, if you request your medical records through the app, we will give you a medical record summary and also give you access to your complete medical record, and that you can share with anyone you choose.
Excellent. Okay. That's good to know.
A great way to store your own medical information.
Who was that?
It was Lisa.
Oh, Lisa, I didn't hear you. Okay. Well, repeat it. We couldn't hear you.
I said that'd be a great way to store your personal medical information. So if you move like I recently did, and you have to change oncologists and radiologists and everybody else from one state to another, and everybody wants to know everything about you, and you have to sign 15 different authorizations.
Yes.
If you have it in one place that you can share it, that would be very nice.
That is amazing. And we can't thank people like yourselves, Amanda, for coming up with the ideas and then sharing it and making it free to, especially our men, but all the others that are going through breast cancer and women. I mean, that's amazing in itself.
Of course, I think it's really important to just get this information out. We're not looking to make money off of it. We're just trying to get the information out. So thank you.
That's wonderful. So, Harvey or Rick, do you guys have anything that you all want to discuss or bring to a point?
No, a general point, not really applicable to either speaker, but my involvement with MBCC has made me very aware this year of during October of the male presence in breast cancer. So I have deliberately looked anytime I've seen any issues around breast cancer awareness to see if men are included.
Right.
And the answer is not enough.
Right.
I pointed an interesting article out to Peggy earlier on today that was in the Memorial Sloan Kettering October newsletter featuring a male breast cancer survivor. They didn't mention MBCC, unfortunately, but Peggy's working on that. I just think that the more we keep pushing to create create the awareness of male breast cancer, the more success we're going to have in future years. And a lot of the success we're having right now is due to MBCC.
Well, we're having success being able to use your platform because you all know we're broke. We don't have anything, but we have so many men with a lot of heart out there that want to know and they don't want to feel alone. And that's what this MBCC family is all about. We're here, and globally people are finding us, thank God to social media, just to bring all you guys together and be able to do these chats and talks and put out the information out there, because not one of us can do it alone. It takes everyone to do it as this family continues to grow, which is a sad case. But guess what? I don't see immediate that breast cancer is going away anytime real soon, but they are making a lot of headway. I mean, this month alone, I cannot believe with some of the breast cancer vaccine they're talking about, all these different ones and clinical trials that are out there are just really amazing. And Jeff, I think, asked a question here. Citizens was on last month, and they're another app for medical records also. And so it's like I tell Jeff, anytime we find anything, we bring it to you all. You all decide what you want to use and what's going to be right for yourselves. And, I don't know, because I personally can't get on either of the apps because I'm not the survivor. Brett is. And Brett said he loves Citizens. Now I'm going to tell him about your all's too, which he knew you were going to be on. I was hoping he could get on. But again, he has a brand new 9-week-old baby girl. Just picked her up from our daycare here and was going to try to rush home to get on. But the bottom line is we want to offer these things to everybody. But go ahead.
I'm just glad as my foundation celebrates its 10th year anniversary this month. We were one of the first to do this. When I went through it, it was very difficult, and I just said we got to change the way male breast cancer is looked at
Very
in
much
general. And I think we've, with your help and with Michael's and everybody else's participation, we've brought it out from inside the closet to outside the closet to the front doorstep. We just have to make it. We just have to keep doing what we do.
Totally, Harvey. I agree with you. And we've got to do it together because knowledge is power here, and it's amazing.
Right. I did at my sister. I did a podcast this week, and we talked about this. How all these organizations are banding together. We all have one goal in common. I just saw a post from, we all know him, from Ambrose,
yes,
who is suffering a setback with a thyroid cancer diagnosis.
Yes, I knew that.
He was at the Mayo Clinic. He was at the Mayo Clinic, and he just, he's in the waiting room, and he actually saw 2 huge photos that both pertain to how to check for male breast cancer and what to do if you think you have it. And he just posted it on his Facebook page. So
excellent.
Ambrose has been, he's amazing. I mean, he's been through more than
a lot of the guys. Yes.
Yeah. And just keeps on plugging away. And, it's his voice that has a lot of carry. It's our voices that have carry. And the more we can have our voices heard, the more headway we can make. I've seen amazing changes in the 10 years that I've been doing this. And, we still have so much further to go, but there are changes.
Yes. A lot of changes, Harvey, but like I said, we do it all together because that's what makes a difference. I hate to see that Matthew Knowles got breast cancer, but guess what? That was a huge boost for male breast cancer to get it out there to the world that, yes, this exists. That is, we're not, this is not alone. You're not alone in this battle. And the more we can put people out there and everybody sharing their experiences, again, that's why we have the Private Brothers page. So you all can talk amongst yourself without it have to be out there in the open in the public too. And everybody should be invited in. I went through and invited everybody in on the list over a year ago when we set that up, but you all still had to accept the invite. So if anybody, Harvey, I think you're in the group. I was going to go check real quick, but if you're not in the group, let me know so I can get you re-invited in. And again, Facebook just changed a bunch of their stuff again, and it blew a few people out of those secret groups. So I'm having to go back and re-invite them in. So let me know.
I'm not sure if I am, but just send me the invite and I'll accept it, no problem.
Good deal, because I love technology, but my motto is technology's grand when it works, and when it doesn't, we're all screwed. So we all know that. I'm going to check real quick, Harvey, right now while we're on here. But yeah, we're friends. I just resent it to you because yes, you weren't in there. I know Jeff. I'm pretty sure you're on there because Jeff came through Kansas City in September. Yeah, and he's already a member. But yeah, it blows it out, and you don't know. So I guess little by little after October, when things slow down, because we all know this is the only month anyone gets breast cancer. You realize that, right? Breast cancer knows in October. But the bottom line is we're in this together. I'm thinking because of the holidays coming up and Thanksgiving actually falls on our GoToMeeting group meeting. I think we're going to skip November and December, and I'll put that out, but that just means we won't get on the calls because I know everybody's busy during the holidays, but we'll resume in January. But I do want to let everyone know that the conference is going to be here in Kansas City, April 23rd through the 26th, and anyone that wants to come, and we want speakers and everything else to come. It's going to be amazing at the brand new Lowe's Hotel. I'm going to give the link here real quick again, so you all got it on here. But it's going to be phenomenal. And we've got our tentative agenda there, and it's just going to be fantastic because we're lining up Friday all day and Saturday all day. We'll have speakers, and the speakers that are lining up are phenomenal. Dr. Ben Park will be back who was with Johns Hopkins for 20 years and now with Vanderbilt. The list just goes on as we continue to get them lined up. And I just got 2 more agreed that they want to come and talk. Even Rick Davis is talking about coming from ANCAN here. But we've got some of the top doctors across the nation that are going to be part of the conference. And last year, the speaker day was just one full day, and we realized then we needed 2 days of it. So that's why we extended to an extra day of speakers to give you guys more chance to ask questions and talk about it. But we filled up the line so much last year that they would talk, and then you got to visit it with the speaker at night. But we want that to change a little bit this year. So, if you can make it, let us know. The Lowe's Hotel itself, normally it's a brand new hotel, won't open until April the 2nd, downtown Kansas City, absolutely gorgeous. Normal rooms go for $365, and they're giving us a $149 rate per night, which is amazing because this place is phenomenal. It will be one of the nicest, if not the nicest, hotel in Kansas City, brand new. So we invite all of you to want to attend, and Lisa, if you'd like to speak, and Amanda also about what you all are doing, we welcome it. So just want to let you know. So Harvey, it would be amazing if you could make it too. And Jeff, we talked about it when he was here in Kansas City for barbecue, so he was going to look at possibly doing it too. So
all right, but then I'll look and see if we can block the dates for.
That'll be wonderful, Harvey, because like you say, you and I and all of us have been doing this for too long. It's time to meet each other in person because it makes it so much more. We're family now, but it'll really make us more family. So if that's understood, but there any?
I'll be able to be doing it for 20 more years too. So
well, God bless you. This is true, Harvey. I hope for another 50 for both of us, but that put me into the 110 years age group, but that's all right. We'll still be preaching it, but thank God for yourself, Harvey, and Jeff, and all these other guys in the family that are willing to talk about it and wanting to help others, because that's what it's about. And you, Lisa, also. So it's just amazing, totally amazing. But, the 20. Okay. Jeff said, what time to arrive on the 23rd? So of the conference, the 23rd is actually the Thursday arrival, and we want everybody to start arriving in by dinner time, because I'm going to have everybody out here to the house, and I'm going to be cooking my famous mama burgers for everybody, because all the guys hear about the mama burger parties, and we're going to do it that night. We'll have shuttles going back and forth from downtown out here to the house to bring you to eat burgers, meet each other, talk, visit. We'll serve margaritas also, because that's part of our real business other than cancer. We do margarita machines, and we'll just have an unbelievable time. So I say get in town by dinner time, which is about 4 or 5 o'clock if you're booking your flights and stuff. But more and more of the detail I should have up here within the next week or so, because I just talked with the hotel. They got their final opening date just yesterday, that they will definitely be open by official opening April 2nd, but hoping to have rooms open during March through the Big 12, because that's so big here in Kansas City with the basketball conference. So it's going to be a lot of fun.
The 26th will be Sunday. Will you be wrapping on Saturday and everybody kind of?
Yeah, Saturday night will be done, and you can take your flights out on Sunday anytime. But you'll want to be here Saturday night. Will be our big banquet and all that. So it's going to be a lot of fun. That's all I can say. And we will take our tops off shoot photo with all the guys. Last year, some of the guys didn't want to take their shirts off. That's just fine. You don't have to. But it's the ongoing, tradition that they've started to do the tops off shoot. And if they get the roof of the Lowe's done, which is 9 stories high, they're going to let us take it upstairs on their rooftop, which will overlook all of Kansas City. And again, with new constructions, you never know. But there's so much that we've got planned, a lot of fun we'll have. And like I said, if you plan anything for this coming year in 2020, this would be something I say not to miss. It's just a lot of good time.
How far is that hotel from the airport? Do you know?
It's approximately 15 minutes from the airport. So again, there's shuttle service. And the last time we were here in Kansas City in 2017, I arranged with a shuttle company, and they gave us special pricing for everybody. They gave a discount because everybody was, cancer patients and stuff. They gave a discount for us, and I'm sure they'll work with us again this time too. Okay. So it's shaping up so far to be an amazing deal, and it'll only get better. And like we had last year, Pfizer was there talking about their eye brands. We had Novartis was part of it, Lilly Company. We had a lot of big of the pharmaceutical companies besides the doctors that are specializing in male breast cancer. And I'm going to attend, myself and Pat Washburn's going to be attending with 2 of our guys, Rod Ritchie and Kevin Barnes, the San Antonio Breast Cancer Symposium. And that's December. So that's when I get a chance to meet all these other companies and doctors that are there, and anyone specializing that we can ask to come be part of our conference. We will be doing that also. So it should be pretty good. I'm hoping to get Dr. Sharon Giordano, who is partners in crime with Dr. Ben Park, but so far she's from Houston at MD Anderson, and so far her schedule has never worked out during that time of the year for her. So I've already asked. She's checking it out to see if it's possible. So I think we're going to get some amazing doctors here.
Nice.
Definitely. But is there any other questions or anything you guys want to discuss? And if
maybe Matthew Knowles will want to come and speak.
Well, seriously, Sherry was trying to find out how to reach out to him. I put that on her to see if he'll come,
Just contact the PR.
Well, yeah, because they got to meet him, Michael Singer, the Dr. Oz show. All of our guys were in the audience for the Dr. Oz show, so they got to meet him. She told him about the conference coming up, and she said they would check it out. So we'll see what happens. You never know, because he will have just gone. I think he's having the other prophylactic mastectomy, January is what he's been stating. So hopefully he'll be well enough to travel again. We'll see. But
it never hurts to ask.
No, we ask everybody. Just ask the guys.
You don't seem shy.
Yeah, never part.
Nope.
Excellent. I will do that. And then Rod Ritchie, I was talking about San Antonio Breast Cancer Symposium. Jeff is just asking to send information. I will do that to you, Jeff. But Rod Ritchie from Australia, he got a grant with him and Kevin Barnes. So they'll actually be attending on a grant as male breast cancer survivors at the conference, and actually attending all the speaking sessions and all that. We're actually down there to strictly run the booth that they allow us to have. So, and this will be our 5th year that we will be there. So it's going to be pretty amazing. And Daniel Garcia lives there now, so him and his wife's going to help work the booth too. But the other guys will also. And Jeff, I'll send you information. You're asking on it about the symposium and the dates. So that'll be great. But anybody else have any other questions?
Thank you, man. I gotta get off. Thank you so much for doing this.
Thank you, Harvey, for being on. We appreciate you guys. Happy Thanksgiving Day and happy holidays for the holiday season in December. Okay? We love you guys. We'll talk soon. Thanks for everybody being on. Bye-bye.
Bye.
Bye-bye.
Bye. Thanks for having us.